Hi, my name is Luis Hernandez, LACC Psychology 1. Um, One of the topics I'll be talking today, it's bipolar disorder. And bipolar disorder comes in four different stages, but I'll be talking bipolar 1. Bipolar 1 disorder, it's a mental illness disorder or a manic depressive disorder. And what the symptoms that comes with that is mood swings, euphoria, uh, mental instability, um, rapid changes of thoughts. One minute you may feel sad, the next minute you may feel angry, the next minute you may be crying, and so far. With bipolar disorder, it starts in the early ages of 17, around there, but it could happen to anybody during any stage of life. But at the time, bipolar scientists or psychologists, they don't really know when it happens or how it starts, but it's still being studied at this point, how to prevent it and how to help out as much as they can. Um, with bipolar 1 disorder, it's a mental illness, so sometimes it could be dormant on you for a while and not know that you have it until you have an episode. But it doesn't mean that you haven't had it or you don't carry it. And also, bipolar disorder, it comes from the families. If your family, of one of your family members that are close to you have it, this means that you are high risk of having it too. So keep that in mind. One of the things that I see here in the U.S. or in the third world countries, a lot of people are suffering mental illness, and it's because our healthcare is really poor. A lot of people suffer from mental illnesses or bipolar disorders or any kind of disorders of so far, and we don't realize we have it into like bipolar has four different stages, into maybe you're in second stage or third stage or fourth stage, and when an episode happens, it could trigger it to be really severe, and you could end up in the hospital or in a psych ward that sometimes a lot of people are unable to recover. But bipolar disorder, if you treat it from the early stages, you could live a progressive life and a normal life. If you with treatments, one of the treatments is therapy session, going with a psychologist or social worker or a clinical worker that it's trained for this kind of disorders or behaviors. The other ones is medication. With medications, you have depression medication, antipsychotic medications, sedatives, and so far on. And also, one of the things I forgot to talk about, after you have an episode of bipolar, usually depression comes afterwards too. So look out for that too. And also suicidal thoughts. Depression has suicidal thoughts too. So be careful with that. Always look for help. Don't wait for the last minute. Also with bipolar disorder in the U.S., usually it's around 2.6% that people suffer. Around 6 million people around the U.S. with this so on. We have to help each other on if we can. So on, yeah. So one of the things that I look for myself, it's always, and I could recommend it too, know yourself really well, know your body really well, know your thoughts, and keep a spiritual, meditated life, easy spirit life. Try to, I know it's a stressful world and chaotic at times, but try to sensitize yourself by having a cup of tea, joining with good friends, have a social life, practice meditation, good life, to, and also when stuff like that starts happening, ask for help as soon as possible. Don't wait for the last minute. Thanks.